Florida Department of Health, Duval. Our next guest is responsible for ensuring the health of not just a few patients, but for everyone who lives, works, plays, and visits Duval County. That includes letting the public know when their health or safety may be at risk. And you may have heard on the news that there are several suspected cases of Legionnaire's disease under investigation here in Florida. Joining us with details, we welcome Dr. Kelli Wells to the show. Welcome.
Hey, welcome back.
It's so good to know that anytime something happens, we can call you and be like, what's going on?
We get like this, and you're right here.
All right, so let's start with, what is Legionnaire's disease? Am I even saying it right?
You're doing fine. So it's a bacterial illness, and it causes pneumonia. And it gets its name from the fact that it was first identified at an American Legion convention.
Oh,
wow.
Yeah,
all right.
Oh, very interesting. So, you know, we went from, I had never heard of this term, to all of a sudden, boom, 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 it's everywhere. It's in gyms. And also it had something to do with all those unfortunate people that passed away in Flint, Michigan with the water issues as well.
Well, Legionnaire's, the bacteria actually loves warm water and water systems. So it tends to be found in plumbing systems. We see it most often in like assisted living facilities, nursing homes, those sorts of things. And the water supply can become contaminated. And that's how the infections begin. So anywhere you've got a large water system, you can see that happen. Doesn't tend to be like in your car air conditioner, but like in air conditioning systems, in the plumbing systems of hotels, that sort of thing.
That are not used frequently enough, so they sit and develop this bacteria?
No, the bacteria just enjoy the warm environment, and so there's some specific things that owners of properties like that have to do to prevent it from being contaminated with Legionella. There's some guidance that we provide and that the EPA provides to business owners.
So do you help identify potential risks of this and then go to them, or how do you do this?
Well, so the department does a couple of things. First, we have a long list, it's a pretty long list actually, of reportable illnesses. So whenever someone is identified as being infected, we immediately get a call.
Trace it.
Yes, and so actually before it's confirmed, we get the suspect case and begin, the investigation. And once it's confirmed, then we go to the place where the exposure has occurred and get with the management to talk about how to clean up their water supply. Right? When it's happened, we do intermittent surveillance to be sure that those standards are being maintained.
Excellent.
But it happens. I tell people communicable disease is communicable.
So when you mentioned pneumonia, it gives people pneumonia.
Yeah.
So it's totally different than how do they tell that it's not just regular pneumonia, that someone got Legionnaire's disease as opposed to just getting pneumonia.
And so that's another great place where I think the department really works to help. So we work very closely with hospital infection control staff, with infectious disease physicians, with infection control nurses in hospitals. And we train folks to think of this, among other things, as they are treating a pneumonia and it doesn't turn around very quickly, or they're treating a patient with pneumonia who is over 50, who has come from a facility with a large sort of communal
So you
water
back into the fact that it happened in a gym or it happened in...
Correct.
Oh, interesting.
Correct.
Interesting.
A lot of research.
Now, where are these suspected cases cropping up here? Like you're saying right now, the most obvious are in
ALFs and nursing homes, typically. But certainly there's the tendency when you've got folks who are at risk, so over the age of 50, possibly with other lung illnesses or problems, they are at risk. So you might find
it does show up in younger people, though, not just over 50.
It can, but it's unusual. It's much more common in the older population, which is like our typical Legionella case is in an ALF or in a nursing home.
So how do they get rid of it? So let's say you call the nursing home and say, hey, guess what, 3 patients.
Right, so you're going to treat the patients with antibiotics, and then we move the business through a stepwise sort of system to clean up their water supply. There's some purging, you heat it to a certain temperature. I mean, there's a lot of things that we do to clear the water system.
That seems like a lot for them to do.
Yeah. It's a lot, but it's the responsibilities. When you take responsibility for providing anything for large groups of people, then you also own the responsibilities of ensuring their health and safety.
So if you mentioned earlier that these facilities do things, ahead of time to prevent this from happening. When it does happen, does it mean that they didn't do what they're supposed to do, or does it mean that it just happened?
It's not typical that we find that.
Okay.
We certainly do inspections of a number of facilities in every community. So we do a lot of school facility inspections and daycares and those kinds of things, certifying that they meet a standard to promote health. But often things happen and it just happens. You know, and so that's the reason that we do surveillance. That's the reason that we track things. I've mentioned before that we track what comes into hospitals, we track clusters of symptoms and that sort of thing, so that we can identify where outbreaks come from, because it can occur.
So really quickly before we wrap, as a patient, how would I know if I need to run to the doctor?
Your symptoms. Typically it's cough, fever, headache, and it doesn't resolve. Right, so in most cases, a common cold may give you those symptoms, but you're going to be feeling better on the other side of 3 or 4 days, typically. So things that are persistent always should prompt you to go for an evaluation.
All right, well, let's move on to another health issue making headlines. A rabies alert was issued this week in Jacksonville Beach. We tend to hear about rabies alerts a lot in the summer. Is it actually that active in the summer? Can we expect this every year to be a problem?
Rabies is something that infects wild animals. And as long as we've got people who are going to be touching wild animals, there is the risk of infection. And so one of the things we were actually preparing to do this year in conjunction with Parks and Recreation here in Jacksonville was a campaign. Really just reminding folks, you know, as you're out fishing off creeks and bridges, and, you know, I can't relate because I don't do that. It's like outside, yeah.
I'm not even a glamper.
Right, I was like, I'm not at risk because I'm not going to be there. But people do that very frequently, and it's a family event, and it's a ton of fun. I used to do it when I was, you know, young. There was one of the treasured memories with my dad, actually, was going fishing. But, you know, raccoons and other wildlife, I'm told, approach while you're doing this sort of thing. You
Some
cannot.
people think raccoons are cute, but
Wait, what is
They're grown like rats.
what does an animal look like if they have rabies? I mean, can you tell?
You can tell when they're ill. In this particular instance, the case that we are dealing with now, the kitten actually became sick after multiple people had sort of handled it and had interaction with it. But an animal that's sick with rabies has bizarre behavior. Right, so I remember one time we were driving down the street, there was a possum on the sidewalk just sort of walking itself in a circle. Right, that's not usual. You'll see, you know, animals, dogs eating things that they wouldn't normally eat.
Can a pet catch it from another animal outside? Like
Absolutely, absolutely. If they're not vaccinated,
they don't have to
are
kiss
at risk.
each other to get it?
It's easy to get, and so that's the reason that, you know, just please
never going outside again.
do not touch an animal you don't know. Just don't.
Well, you know that'll never happen.
But what are the signs of
animals
rabies?
are going to touch every pet they can get their hands on.
Yeah,
of course.
You know, I am the
Or unless you're scared to death of most animals, which I am,
so
you don't run a
might
very
be
high
safe.
risk.
Right.
But what are the symptoms of rabies in humans?
Well,
Like, are we walking around in a circle too?
Yeah, well, it's an infection of the nervous system. So you do get dizziness and confusion, delirium, paranoia,
That's every day.
hallucinations, headaches,
Is it
nausea,
still treated
vomiting.
the old way? I heard that they have to stick a big needle in your stomach.
So this is the thing. This is the
not
story
wanna
you
get
tell
it.
your this is the story you tell your kid, so your kid doesn't touch the strange dog.
Okay,
strange
good.
dog,
All right,
right?
give me the details,
Because
please.
you
I need to
inject
know. I gotta arm
the
everybody.
immune globulin into the wound,
Ugh.
right? And then you have to have the vaccination series.
Because there are
Just
these
don't
stray
touch it.
cats that are right around where my children exercise. It's crazy, these stray cats that are around, and
Do
they
not,
scare.
no
I'm
matter
always
how
like,
cute they are.
girls,
Yeah.
go
I
get
don't
away.
think feral cats are cute.
So is that it for? I mean, Jacksonville Beach right now is under this rabies alert. Is that all they have to do? Is make sure they're not touching strange animals?
Don't touch strange animals. Be sure your animal is vaccinated, and it might be worth a trip to the vet if you have not done that. And then talk to your kids, your family members. Be sure that they are aware. It really, more than anything, is awareness.
Yeah.
Well, thank you for that very important bit of discussing information. It's important, though. All right, well, Dr. Wells isn't going anywhere. We have a lot more to talk about. When we come back, a lot of people are choosing to wear blue today. What's going on with that? Well, Dr. Wells has the explanation right after the short break.
Next, Ellen, Ashton Kutcher.